A very good evening all. I'm Didi Lamba with the Thursday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 118 million cases of COVID-19 with more than 2.5 million deaths. Here in the United States, we are at more than 529,000 COVID-19 deaths with more than 29 million cases. Today marked 1 year since the World Health Organization first declared COVID-19 a pandemic, a year of loss, of pain, but with a ray of hope at the end. This past year has taught us a lot about ourselves and communities around us. From remote work to virtual schools, this pandemic has altered the way we live, and some of these changes could go on long after the virus is gone. We have suffered a devastating loss of more than 500,000 COVID-19 deaths in the nation, and to all those who lost a loved one, we send our prayers and condolences. Today is also a stark reminder of continuing practicing the 3 CDC guidelines to curb the disease. This is not the time to loosen restrictions, and we must remain vigilant. In politics, a historic day, President Joe Biden has signed the massive American Rescue Plan of $1.9 trillion into a law. This will bring relief to millions of Americans who have been impacted the most by the ramifications of the pandemic. The package brings in $1,400 stimulus checks and $300 weekly unemployment benefits. We have tonight more on the impact of coronavirus as well as insight into changes in the fashion industry tonight. Here are the headlines. Dr. Purvi Parikh addresses COVID-19 vaccines and variants, New York City. Fashion Community Week presents Virtual Fashion Tech Conference 2021, San Francisco. Dr. Sumeet Bahl on meditation for COVID-19 mental health crisis, New York City. It's time for a short break on Vision of Asia South Asian News segment. We'll be back shortly. And welcome back. I am Didi Lamba and this is Vision of Asia Thursday night episode of South Asian News. Let's take a look at coronavirus measures and updates. Today marked a whole 1 year since World Health Organization declared COVID-19 as a pandemic, and we marked this year with a loss of more than 500,000 deaths in the United States. With this loss of life and stress of the economic ramifications of the pandemic, there is now a mental health crisis acting as a shadow pandemic of its own, impacting millions of Americans. Nearly 4 in 10 adults have reported symptoms of depression and anxiety or stress related to COVID-19. Public health measures of social distancing especially has brought in a feeling of isolation and loneliness for many, leading to several mental health crises. So how should we handle this ongoing anxiety, stress, and depression right now? We spoke with Dr. Sumeet Bahl, who had a unique take on coping up with the mental health crisis using meditation. Here is Dr. Bahl. We have you today to discuss something very important, which is dealing with the mental health crisis in the country, as well as stress management. When you are looking at meditation, and this was a really good insight into it, of how it really calms down the body, how do you use meditation now to then handle grief and trauma? That's another 2 issues that we have seen across the nation. With the loss of life, there's a lot of grieving. Trauma experiences have been there for the families, doctors, and so on and so forth. How have you used that?
Personally, for me, I keep a regular daily meditation practice, but fortunately in my hospital, I've been asked a number of times to help some of the other physicians at my level, meaning no longer in training, as well as trainees, residents and fellows who are going through training and have dealt with these patients on a day-to-day basis in the ICUs at the peak of the pandemic. And I had given some instructions on meditation because in order to heal other people, you have to make sure you're healed. You have to make sure you're mentally and physically as strong as possible. So I think we all need it. And we were facing the hospital as a whole, a lot of the residents and fellows and other doctors who were definitely in the ICU, in the emergency room, they were facing a lot of grief. They were seeing a lot of death in front of themselves, and I was dealing with the complications of those. We were all trying to find coping mechanisms for ourselves and with patients. And again, that brings me back to meditation. That's what I was teaching them at the time. And it's something I've been doing for myself. And look, I don't care who you are. I don't care how advanced you are. As long as you still have desire, still have the attachment to this body and mind, you're still going to feel some degrees of grief and loss whenever something, negative happens. That's a natural response to it. But what you're learning to do is you're learning to cope with those things better, because they're inevitable. Grief and trauma are inevitable in life. Right. So what you're trying to do is manage your expectations with those, manage how much you respond to it. And that's an important concept. I'm not always in control of my circumstances, but I'm in control of my response to them. And that's where meditation comes in. You learn to be more detached from those situations. Not that you care any less, but you're just more detached. You understood that I did everything I could for that particular person or that particular situation. Moment to moment, I did everything I could, but the results are out of my hands. And once you learn that, you're a lot more calm about it, and you're able to move on to the next thing.
Right. I have 2 more questions left here for you, Dr. Bahl. I would love for you to give us a small demonstration of meditation, anything that somebody could be doing while sitting. What do you suggest? We would love to get some tips from you.
Sure. So one of the basic premises of mindfulness meditation, which I think is a really wonderful way to start, is to pick a quiet place. And what you're going to do is you're going to sit with your spine erect in a chair. So your back as straight as possible, and your palms, just like this, your palms facing upward, and just relaxed on your thighs. And your chin is going to be parallel to the ground, so it's basically looking straight ahead. And your eyes are going to be slightly lifted to the point between the eyebrows. And that is the what we call the third eye in Hinduism in particular. But actually, you'll notice that concept in a number of faiths. And you slightly lift your attention to that point between the eyebrows, and you're going to close your eyes. And all you do is you just be aware of your breath as it goes in, as it goes out. You don't try to control the rate of the breathing. You don't try to even control your thoughts. You allow them to come and you allow them to go. And the idea is that you're basically watching the breath and not being bothered by all of the mental distractions that are going on. And each time your mind wanders, don't even think about it. Just bring your attention back to the breath. And then very shortly thereafter, your mind will wander. It's okay. Just bring your attention back to the breath. And so, and by doing that, you will start noticing that your heart rate and your breathing start to slow down. And even just a matter of moments of doing that, not even 5 minutes, just even 1 minute, you'll start to see that benefit. And that's the basics of mindfulness meditation.
Right. It's truly regulating the body, as I can understand from you. It was so great having you with us on ITV Gold. I would love for you to give one last message on this topic to people, perhaps to people that are struggling right now and do not know where to start from.
I would say that if when you want to begin a meditation practice, one of the really good things you can get in the mindset of is, I don't have to be perfect at it. I don't have to have an hour a day to be able to do that. Any time is better than nothing, and any effort is better than nothing. So don't use your schedule as a hindrance. Don't try to be perfect at it. Just regularly sit where you are, follow that basic premise of the technique that I was talking about, and just start doing the practice. And the more and more you do it, just like anything else, I can describe how cake tastes, but you're never going to know until you actually taste it. It's the same thing as meditation. It's all based on experience. And that's where you can get started. As you do it more and more, you may be prompted to start, to looking for organizations and other means to do it, which are all over the internet. Of course, you're going to find a whole range of things. One really effective place I think is wonderful is Headspace. It's an app you can get on your phone, and they've even released it on Netflix too, which I think is really wonderful. It's a really wonderful place to start.
Yes, definitely. Lots of apps on that. Thank you so much today for your time here on ITV Gold, and I wish you the best in the hospital. I hope you keep on bringing us more good news.
Thank you so much. We're going to keep working on it.
While we mark 1 year anniversary of the coronavirus pandemic, there is definitely light at the end of this tunnel. Currently, the nation is averaging more than 56,000 new cases per day, the lowest that this metric has been since October of 2020. The daily hospitalizations have also dropped this month, but experts say that this is not the time to stop practicing the 3 key guidelines of social distancing, hand hygiene, and most importantly, wearing a mask while we wait all to be vaccinated to truly go back to a sense of normalcy. More on vaccine. 127 million COVID-19 vaccine doses have been distributed in the US and about 95 million have been administered. Vaccinations are picking up speed and states are easing eligibility requirements to get them more. More on this vaccine and coronavirus pandemic we have now another segment of our conversation with expert Dr. Purvi Parikh. Here is Dr. Parikh. Another issue that's up for debate, and it's been something that President Biden is also stressing on, is reopening of schools. Today we heard a huge news from LA that they're opening up and they're one of the largest school systems in the country. And my question to you is it safe, according to you, to open up these schools and let these middle schoolers and high schoolers go back into those settings without these teachers fully getting vaccinated? What is going to happen? Why are they suggesting that it is safe to open these schools up right now?
Right. So schools are in general, luckily, and this is excluding colleges, but schools like high schools, elementary schools, luckily have had very few cases or outbreaks, since this pandemic started. And unfortunately, I think children in general have lost a lot from in-person learning because it's very important in development at all ages, and it's very crucial for learning. So I think getting kids back to school safely is actually a good idea because unfortunately, I think a lot of children are suffering the consequences of, adults' mistakes. But that being said, I think absolutely all the teachers and anyone who interacts with children in these environments should be vaccinated because, they could spread the illness to children or vice versa. And we don't have a vaccine ready yet for school-age children. So absolutely, I'm for reopening schools, but as long as all of the adults are also vaccinated and they're still taking those precautions. So the masks have to continue in schools, the distancing, and the other hygiene and sanitation measures.
Right. When you're looking at the reopenings, do you see most schools reopen by the end of this year if everything is vaccinated? And my follow-up question to you is, you just mentioned children getting vaccinated. What insight could you provide us on that?
Yeah, I think by the end of this year, I do see most schools reopening. And the good news is, speaking of children and vaccines, they're already studying age 12 and up. And I don't know if you heard, Alaska is starting to vaccinate 16 and up as of today because they're so far ahead of their vaccination schedule. So, I think at least that age group, we will definitely, 12 and up will start vaccinating by summer. And then after that will be probably the younger children because we need to study the vaccine in each age group. So I do see that hopefully by the end of 2021, hopefully we'll have most schools operating kind of normally because hopefully by then all the adults will be vaccinated, majority of the children will be vaccinated. So I'm optimistic about that.
Right. I just have 2 more questions left here for you, Dr. Parikh. My first question to you is, right now the Biden administration is trying to do its best to ramp up vaccination, but there are still a lot of uncertainties in states. There are many people who should be vaccinated or not vaccinated. What do you think they need to do in addition to whatever they're doing right now?
Yeah, I think just access to these vaccine sites needs to be easier for people, and signing up for vaccine appointments needs to also be easier, meaning, there needs to be sites that are 24/7, especially for people who work long hours, weekend vaccinations available. And then, the whole signing up process is not easy, because even though it's online, sometimes it's hard to find out if there's an opening last minute. especially for elderly people who might not be good at using, computers or technology. So I think we need to make it as easy as possible for people. So even if that includes calling a number or even just showing up, there should be a way to accommodate people, especially for those extra doses that I've heard are being discarded. That should not be happening. There should be some type of walk-in policy at all of these sites just to make it as easy as possible for people to get vaccinated.
Right. And my final question to you is actually a little different. It has to deal with the world. We're hearing that, a lot of first world countries, including the United States, are vaccinating its people. The process is going on. However, there are some very poor countries that haven't even started the vaccination process. How important it is for each country in this world to be vaccinated, according to you? And what impact would it have if poorer nations are not vaccinated?
Yeah, actually, that's a very good point. It's extremely important because one, just from like a social and health equity standpoint, I think it's unethical if only the richest countries in the world have access to a vaccine and the poorer countries do not, because that's just inhumane, and human rights issues then come into play. But even if you don't look at it that way, it's actually in everybody's best interest for everyone to have access to the vaccine because, the UN Foundation says it well, an outbreak anywhere is an outbreak everywhere, especially in 2021. So an outbreak in a country that, you may not know anyone, right? That same virus can end up in your own backyard the next day. I mean, look at this pandemic, right? It started across the world and now it's completely changed our lives. It's taken 500,000 Americans. So it's actually in our best interest too to ensure that everyone globally has access to a vaccine.
Right before letting you go, I would love for you to give a message out to anti-vaxxers. We're hearing millions of people are still against getting this vaccine. What do you say to them?
Right. I mean, I say the same thing always, you really should be more afraid of the actual virus than the vaccine itself. The actual virus has far more side effects, the worst being death. And even those who survive, I think 75 to 80%, even a year later, are now living with some long-term complication from their COVID-19. So whereas the vaccine, we know it's safe, we know it's efficacious, the side effects are short-lived. I myself have gotten it. So, I wouldn't inject myself with something that I thought was unsafe in any way. So that's the biggest message. The virus has far more side effects. Again, more than 500,000 Americans lost, millions lost worldwide. It's completely changed our lives in just 1 year. So to me, it's a no-brainer.
Well, it's time for the short break on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Aditi Lama and this is Vision of Asia, South Asian News segment. Let's now take a look at the Fashion Community Week, a non-profit organization focused on providing a marketing and business platform for fashion, beauty, and technology industries to showcase their products and services. Based out of California, it calls itself the Global Intersection of Fashion in San Francisco, which supports emerging local and global fashion businesses. On that, recently, the Fashion Community Week presented a virtual worldwide fashion tech conference on the future of fashion. Featuring CEOs of global fashion tech companies, the virtual event discussed projections on the future of the fashion industry brought by current affairs and the changes that are a result of an ongoing pandemic. Here are some highlights from the Worldwide Fashion Tech Conference 2021.
Hello, I am Shireen Hashim, CEO and founder of the award-winning Fashion Community Week, established since 2014. We are a business and marketing platform that offers support and opportunities for emerging global fashion designers and brands. Since our existence, we have launched and represented brands from 52 countries covering 6 continents. Through our platform, presenting brands takes part in our exhibition, showroom, shopping event, conference, and of course, our famous runway shows. In the year of 2020, we have launched as an online incubator for fashion designers and brands to offer support. Our programs include educational interview series with industry experts an e-boutique platform for our fashion designers to sell their collections, one-on-one consulting services and workshops on brand launch and development. And finally, a virtual fashion week to continue supporting brands with exposure, PR, and marketing. I'd like to welcome you all to the opening day of the 12th season of our Fashion Community Week. Today is our worldwide fashion tech conference taking place in a form of panel discussion with 5 fashion industry founders, joining us to share about their innovative fashion tech companies and how they are impacting the future of the fashion industry.
Sure. My name is Cece, and I am the CEO of Trendalytics. And previous to that, spent a decade working everything from financial planning to merchandise planning at a variety of different companies, including Target, Jimmy Choo, Michael Kors, and moved over to tech 3 years ago, 3 years and 1 month ago, actually, exactly.
Hi, everyone. Thank you for having us. I am the CEO and founder of iFitU, headquartered in Zurich in Switzerland. We also have an office in the US on the East Coast. iFitU is an AI-based sizing recommendation tool for fashion retailers. We have launched on the 12/12/12. That's when I founded the company. And we are integrating in many e-commerce sites and have now rolled out our omni-channel suite of solutions for apparel retailers.
Yeah, thank you for having us. I'm Hanif Brown, the founder and CEO of FitMatch. Before founding FitMatch, I worked in retail investment banking and then retail private equity, where I saw different retailers of different stages of growth, scale, and face opportunities and challenges in their business. FitMatch is an AI platform that is an end-to-end middleware software helping brands plug in and optimize different fit tools on the front end. Really excited to be a part of the conference and listen to the other panel members.
My name is Julie Evans. I'm the founder and CEO of Sustalytics. So it's a B2B SaaS platform that helps fashion brand predicts what consumers want. Before founding Sustalytics, I worked 10 years in the fashion business, including 4 years at Inditex, so Zara's group. Both for Zara and Bershka, I was a head of buying and design.
Hello, everyone. My name is Shahid Joffrey. I'm the founder and CEO at Taffy. I'm very happy to be here, part of the panel. And so what we do is we offer personalized styling at your fingertips. We utilize AI technology to do the personalizing and the styling. And we're starting from the Middle East, starting from Saudi Arabia, and then expanding to the Middle East. We've launched 6 months ago. And we're serving our clients, and I'll be happy to share more about my business.
I'd also like to thank our audience for joining in to be part of the opening day of our interactive virtual fashion week. Join us tomorrow, March 11th, to experience a diverse conversation with international fashion brands creating changes in the industry. Then join us the following day on March 12th to view our new Experience Fashion Runway show presenting this season's collection by international and local designers. And finally, closing out on our final day on March 13th, join us for an interactive shopping event to shop hot off-the-runway collection pieces that are not yet in the marketplace. For more details and schedule, visit our Instagram, Facebook, and website at Fashion Community Week. We look forward to seeing you all this week at our events virtually. Thank you again for joining us. It was such a pleasure having all 5 of you on our panel.
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I'm Aditi Lamba. Take care and be well.